For me, it was a really rapid transition. I separated from the Navy on a Friday, and that Monday I started medical school here at Mayo Clinic. I was a Special Operations Independent Duty Corpsman, which is a medic for Marine Special Operations. And so I did that job for about 10 years, and in that role I was a medic at a team level, so it was me in charge of the health of the 20-ish other Marines that I worked with. In the military is where I really learned to appreciate and enjoy medicine for what it is, and I really learned how valuable patients are in education and how the best person that you can learn medicine from is a patient in front of you. And that's something that I learned in Afghanistan and Iraq, and it's something that I've really tried to keep with me now. And I think that's really kind of like a cornerstone of how I view healthcare and medicine. Leaving the military on a Friday and starting school on a Monday was a very abrupt change, and it was one that was difficult for a good amount of time. But I think really the people at Mayo Clinic made it a lot easier. Having a smaller class size and being able to get to know everyone that I was in school with was very helpful. And those things made that difficult transition bearable. I think that's one of the things that I've enjoyed the most about Mayo Clinic. There's veterans in every class that I know here. I know there's a Marine in the class above me, and then there's some veterans in the class below me. I think the national average is less than 1% of medical school matriculants are veterans, and at Mayo Clinic I'm one of 50 in my class, and most of the other classes have 2, 3, 4 veterans in them. So it's a significantly larger amount of veterans in the student populace than at other medical schools. You know, there'll be times where I'm really feeling strong and I'm focusing really well, and so I'll use those days to try and get a lot done. And then there'll be days where I'm not feeling great, and so then I'll just kind of listen to what my brain and body's telling me. Even if it's just an hour of studying on a weekend, I try and just do something every day. And I really try to not ever cram or really, you know, sacrifice my well-being in the pursuit of learning more, because I don't really feel like I'm going to learn well if I'm not taking care of myself. So I really do prioritize eating well and sleeping and getting outside and spending time with my wife. For me, the most rewarding part has been getting back to see patients. Now that I'm in the clerkship phase, you know, in the doctor's office or in the clinic or in the OR or on the floors at the hospital, and it's just great to get to talk to people again and try and better understand like what their healthcare needs are at that point, and trying to be a part of the team that helps them. And I think here, I don't feel so much like I am a student. I really feel like I am a member of the team, and that has really been helpful for me. Especially coming from another career that I had for 14 years, going right back and feeling like a student again is not very fun. And so really feeling like I'm a member of the team and involved in the whole process of trying to get somebody healthy and out of the hospital again has been really rewarding for me.